Hi, good afternoon. This is Facebook Live for St. Clair County Health Department. It's August 26, 2021, and I apologize because there's something technical going on with my computer. I'm sorry. Um, but I am Liz King. I'm Nursing and Community Health Director at St. Clair County Health Department with
Rebecca Campau, Public Health Nurse, Supervisor of the Preventative Health and Immunization Department here at St. Clair County Health Department.
So we're filling in today for Dr. Annette Mercantile, who is on vacation, and we are anxiously awaiting her return next week. Next Facebook Live, she will be here for you. So first off, we're going to review the data. I think we want to draw our attention to the green in the middle. Those are the changes over the last 7 days. So there was 172 new cases of COVID. 24.6 is the average new cases per day that are coming in. There was 267, the average is 267 tests per day. And then the percent positivity is at 7.5%. All of that has moved us into the CDC category of high, so everybody knows that. Next, you see our 7-day average of new cases, and you see our incline there, slowly going up. This is our St. Clair County COVID-19 vaccine data. Again, our COVID vaccine coverage for St. Clair County residents 12 and older is 52.3%. And then our residents 65 and older are at 77.1%. Looks like a little bit of an increase in the last week for vaccines, which is great news. Next is our COVID-19 vaccine coverage by census tract, and this is just for first doses. And we show this every week, and green's kind of where you want to be. The darker green that you are, the higher the percentage coverage is. The pink is where you're getting lower. So really no changes over the last week. And then this is our dashboard. Up at the top, you see the link where you can find this information all the time.
All right. So Liz, do you want to cover some of the talking points you have in front of you?
I sure will. So what I wanted to speak a little bit about is a partnership with YMCA. So this week we announced that we're working with the Y. They have generously donated a number of 3-month family memberships to the Y for those who are newly vaccinated here at St. Clair County Health Department and CMH. So CMH, St. Clair County Health Department, and the YMCA is working together on this, and this started today at CMH. It's starting here. For those who are interested, you just need to mention it. The passes are intended for individuals who have completed both doses of Pfizer or Moderna or a single dose of Johnson & Johnson vaccine after August 25th.
All right. Thank you, Liz. And just a reminder, those passes are first come, first serve. There's a limited supply. Rebecca, will you cover your talking points?
Sure. So the first thing I have is regarding immunization records. So as of August 19th, anyone who has an immunization record with the state of Michigan can obtain a copy of their record through the Michigan Care Improvement Registry, or MICR, by visiting Michigan.gov/immunize or Michigan.gov/myims portal. So you can go there as long as you have a valid state ID and obtain your record, and that is for anyone 18 and older to be able to go there and access that without having to call or come into the health department here. You can do it yourself right online from a computer or smart device. And then the second point I have is just regarding the full FDA approval of the Pfizer vaccine. I think we all know now on Monday, August 23rd, the FDA did give full approval to the Pfizer COVID-19 vaccine for those 16 years and older. And full approval happens when the FDA has had an opportunity to fully review the data and efficacy of the vaccine. So many months of studies have happened. More than 165 million people have received Pfizer COVID-19 vaccine, and they can assure its safety and efficacy with use.
All right. So the first question we have today is for Liz. Are you going to mandate masking in St. Clair County schools since Oakland County just announced they are going to do so?
Right. So Elise has lined up the heavy questions first here for us. So we know that masking mandates have been talked about so much over probably the last couple weeks or more. But again, we continue to just strongly recommend masking in schools. And at this time, there is no masking mandates. As far as Oakland County, we try to stay aware of what other counties are doing throughout Michigan. All of us in administration are linked into other listservs with other people in other counties. So we do see what's going on for the most part out and about in other counties. Also, what I'll say about masking is masking in schools is voluntary, all the publics, all the private. But voluntary means you can mask. So if you want your child to mask up, send them with a mask. I'm sure the schools will be very accepting of that. And that's still an option. It's still your choice to send your student in with a mask. And I know there's people I've talked to in the community here at St. Clair County Health Department that their kids are going to mask up at school. So I just want everyone to know that.
All right. Thank you, Liz. First question for Rebecca was, I would like to know why close contact individuals who have been vaccinated do not have to quarantine, but those without do. I may be reading the data wrong, but they are just as likely to transmit the Delta variant.
So the data does show that those who are fully vaccinated against COVID-19 are less likely to contract COVID-19. So that being said, in instances of breakthrough infection, and specifically with the Delta variant, those who are vaccinated can still transmit virus. So we know this, right? Even with the vaccine, if you were to contract the Delta variant, you could still transmit it. However, the virus wanes or goes down faster in vaccinated people. So there is a lower risk of transmission and it's less likely to be
All right. All right, so the next question is for Liz. With the boosters recommended for 8 months after your last shot, how will these be rolled out by the health department? Do you have to register again, or will that information be used from the first shot? And will we be notified when we get the booster?
So booster doses, we anticipate starting on or after September 20th. And booster doses will look a lot different than our first and second doses of Pfizer, Moderna looked in the beginning here at St. Clair County Health Department. And the reason being is that vaccine is really widely available now. In the beginning, it wasn't. We know that. But now, those booster doses will be available at pharmacies. So you have to remember the vaccine's available at, let's see, Walgreens, Rite Aid, Kroger, Meijer, Walmart. There's private providers in the community who now have COVID vaccine at their offices. There's pediatricians who have COVID vaccine at their offices. So most likely you're not going to see those big walk-in clinics that we hosted to start. We will be doing booster doses here by appointment. So it is a little different. You probably should just plan to bring your card. We would know if you're going to get a booster dose. That's in MICR. I'm not sure what the other specific questions were. I'm sorry, I forgot, Elise, what
Yeah,
else specifically they needed.
and will they have to go back to that same provider they did the first time?
No, 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 nope. Everybody has record of those shots. So no, you don't have to. And so just because St. Clair County Health Department provided you that first vaccine, you could go to a pharmacy and other way around. So if you went to a pharmacy first for first and second dose, you can come here for that third dose. Everybody has access to those records. Plus it should be on your card that you bring with you.
All right, thank you, Liz. All right, this next question, I'm going to try to interpret, but my question is, why can't someone who hasn't been vaccinated just get the booster shot? What are you boosting the vaccine that was supposed to keep you healthy? Or is the booster just for the ones with a lot of health issues?
So currently, there is a third dose that is recommended for those who are moderately to severe immune compromised. And I guess the best way to describe that would be those who received the initial 2 doses of either Pfizer or Moderna vaccine and are severely immunocompromised didn't get that full level of protection that a non-compromised person would have gotten. So this additional dose is to hopefully get their immune system up to where it should be. With the booster dose that is likely to come out sometime next month, the point of that is to target those who have a waning immune system because they would have gotten their initial series 8 months or more ago, so that immunity is kind of decreasing or waning at this point. As far as we know at this point, the booster dose that is expected to come out next month is not going to be any different than the current 2 doses that individuals received. So there's no real point of getting just a booster dose and not having the other 2 doses, because then you would not be fully vaccinated at that point. So it's no different than the other 2. It's just to help boost the initial 2 doses that you received and help the body fight better against coronavirus.
All right, next question for Liz. Has the definition of an active case changed? Over the last few weeks, the number of active cases listed on the dashboard hasn't even covered the number of new cases in that week, let alone cases over a 30-day period.
Right. So, no, the case definition has not changed. Active cases are cases that our staff are actively investigating. So, those can come in very quickly and be investigated and moved out very quickly. Those can be determined to be not a case sometimes and then come off that list. So, active cases are very hard to track and watch. But there is a document I have referenced here on the MDHHS website. If you really want to get into the nuts and bolts of it, it's called Guidance on Realignment of COVID-19 Case Investigation and Contact Tracing in an Environment of Significant Community Spread of COVID-19. So we can maybe put that on there. I don't know, Elise, if we can list that for somebody who's
Yeah, we
interested,
can.
but that's there at the MDHHS website if you're really curious of how active cases work. I guess I'll note too that for a long time last year, we had a huge number of active cases going on, and that was when we just couldn't even keep up. So active cases were cases who were being investigated, who were done with isolation. Um, we were months behind on closing those cases out. So maybe that's why you're noticing a difference. Is we're keeping up a little better.
Next question. Would you tell me how far apart we will have to space the flu vaccine and the COVID booster? That's for you, Rebecca.
Oh, perfect. So current guidance states that other vaccines can be administered concurrently with COVID vaccine. So there is no need for a waiting period. Previous guidance did state, at least 14 days between COVID vaccine and any other vaccine. But at this point, there is no need to do that. So you can get both vaccines the same visit if you wanted to.
All right. Next question is for Liz. Do you expect companies to require employees to be vaccinated or perhaps pay increases in their insurance, particularly healthcare organizations?
Well, currently, it's up to the individual business if they want to mandate vaccines. We talked a little bit about this last week. Um, we know there are large health systems. That's also been a very popular topic who are mandating vaccines like Beaumont, Spectrum Health, Henry Ford Health System. I think Ascension has as well. I'm not sure. Um, do I personally anticipate? I guess I wouldn't be surprised if they did. We see this going on across the state in other areas with large health systems. I wouldn't be surprised. I haven't heard anything here locally about our hospitals.
All right. Sounds good. So, Rebecca, why are we using PCR test results that are being recalled in December due to being unreliable to quarantine close contact healthy people, especially children? Do you expect the statistics to change when we start using different testing?
So the PCR testing itself was not recalled because of inaccuracies. It was because they were using a different test, which includes influenza testing in addition to COVID testing. It's called a multiplexed method. So PCR testing are still, you know, very accurate and dependable test. It was not recalled because of accuracy, sensitivity, or specificity concerns.
All right, thank you, Rebecca. Liz, for flu
Mhm.
vaccines, will you be doing a similar rollout as of last year? It was so awesome to have a vaccine at the local VFW hall and get the whole family vaccinated.
Yeah, no, actually, this year we won't. It was many years previous to that. We never did those big flu clinics out in the community anymore. You saw us out in the community last year because that was actually a dry run for COVID vaccine clinics coming up. We knew last year at this time that COVID vaccine was coming, that we could anticipate it. So we were actually using those clinics to test different locations, to look at our supplies, to map out how we're going to do this, how we're going to ramp up when numbers increase, and how we're going to decrease. So we use those offsite clinics as kind of a trial run for COVID. So we don't anticipate doing that this year. But flu vaccine, like years previous and last year, I think will be readily available again with our community partners, like all those pharmacies I mentioned, your private providers. We will offer flu vaccine here by appointment only.
All right, and so this question's for Rebecca. Will we be notified when our booster is due?
So we are still waiting for CDC guidance at this point. So we are truly not sure if we will have a notification system or if the CDC using their vSafe app will be able to notify people. So more to come on that.
All right, sounds good. So we're going to jump into the live questions now. It looks like we have some repeat questions. So I'll encourage those folks to go back and watch the beginning of this broadcast for some of those answers. But the first question I have here that we haven't covered yet, when will the third vaccine start being given?
So we do not have a whole lot of guidance at this point. I know right now it's looking like mid to late September. I've heard September 20th as a potential date that it will be approved for use.
Okay. All right, next question. This might be a Brandon question. How many vaccines per week are being given for COVID-19?
So the last 2 weeks? Okay, 5 to 600 per week for the last couple weeks. First dose only.
Okay. Next question. This is a more broad mandate question. Why, with hospitals full and more people getting COVID, are there not mandates going into effect?
Mm, It's a, that's a really good question. Mandates are difficult. I think with that, a lot of things, Brandon's looking at me like he wants to add something right now. I'm sorry. I think it's not that easy to put through a mandate. It's very difficult. You can see the controversy on both sides about all kinds of things being mandated. This process isn't done lightly or quickly without a lot of consideration into all the facts. Um, we hear you, and people have shared a lot of information with us. Um, okay, go ahead, Brandon. Yeah. Of course. So, of course, the simple answer: vaccines are available. They're safe. They're effective. Yeah, for sure. Thanks.
All right, so this next question is about vaccine. Are you keeping track of breakthrough cases, and when will we know that data? Because they aren't so rare, they become asymptomatic carriers and spread it without knowing. Healthy people should never quarantine.
Right. Right. So we talked a little bit about breakthrough cases last week, and there's been a lot of information again. This is another hot topic. And I know that Brandon's looking closely at breakthrough cases. We're hoping to have more information for you on those. When will we know this? Hopefully next week. Yeah, next week for sure. He's aggregating all that information, really drilling it down into what we think is appropriate to share.
Okay. Next question. If I got a shot on April 1st, when should I get my booster?
So at this point, they are recommending, and again, this is initial guidance, so it is subject to change, but 8 months out after your completed series.
And a follow-up to that, Rebecca, is can we mix the booster? She got Moderna the first time. Can she get the Pfizer for the booster? It sounds like.
Yeah, and again, at this point, they are recommending if you got Moderna initially to stay with the same vaccine manufacturer, so to get Moderna for the booster dose, and vice versa for Pfizer.
We have a thank you from Regina. Thank you, Liz and Rebecca, for all the detail.
You're
Thanks,
welcome,
Regina.
Regina.
So just a clarification question about that booster. So are you saying there will be boosters roughly every 6 to 8 months because immunity has gone down?
Well, yeah, no, that's a great question too. And as everything continues to progress and change, I guess wait and see, because there might be a thing similar to how we recommend and encourage flu vaccine yearly. It might be a similar thing for COVID. We really just don't know at this point.
Right.
Okay.
Or, Rebecca, I was thinking about other vaccine series. We boost childhood series too, and then you're good for X amount, like a tetanus is boosted, right? And then you're good
Mhm.
for so many years. So we really don't know. We're not hearing, past this third dose and booster dose right now. What's happening? It's just constantly being looked at and studied.
All right. Thank you, Liz. Next question. What is the cost for the booster shot? Is it out of pocket cost or will insurance cover it?
So no out-of-pocket costs and no insurance billing the vaccine itself. Some places may charge an administration fee, so for the actual person to administer the vaccine itself, but there is no cost, either insurance or out-of-pocket, for COVID-19 vaccine at this point.
Okay. Next question is from Mike. Why do you need this jab if you have an immune system? Because you can still get coronavirus.
Vaccines are safe and effective. It's one of our number one ways that we're gonna stop COVID-19 moving through. Um, I guess, Rebecca, do you want to add on to that?
Yeah, I will just add that, yeah, just like you can still get other viruses without a vaccine, you can still get flu even if you receive the flu vaccine. But I mean, data and science has shown that vaccines greatly reduce the spread of vaccine by eliminating the source of the spread. So if I'm vaccinated, then it's less likely that I will contract COVID-19, therefore less likely to spread COVID-19.
Right. And decrease hospitalizations and deaths, which is very
Absolutely.
important.
All right. Thank you. Next question is from Nikki. Whose responsibility is it to mandate masks, the school board or St. Clair County Health Department?
Hmm. I think the way I would answer that is that either could do that, um, but hopefully that's something that's worked on together jointly um, as things roll out and it's needed. That would be my answer.
Okay, next question again from Mike. I've been around many people that had it and was never notified by the health department for the CDC. I'm not sure, was in close contact with someone that had it. I think he's saying maybe why he wasn't contacted if he was a close contact. Maybe that person informed him and not the health department.
So I guess I will try to answer that as best I can if I'm understanding, Mike, what you're trying to say here. So if they were tested and a known positive, they were reported into the state disease surveillance system, and we would have known about the case, but depending on when these persons were positive, it was during one of our higher surges. We do have state partners that attempt to reach out to cases, and during periods of surge, if there's so many failed attempts to contact, they might not have ever spoken with someone. Therefore, if you were close contact to one of those positive cases, then your name would have never gotten into our contact tracing system to be notified of that either.
Okay. Next question is from Wendy. Is it risky for infants to be in stores if well distanced?
So there's a risk at this point. I mean, just with virus circulating around, and we are in a period now of high virus in our county again. So there is a risk. I mean, there are, again, mitigation strategies. So if they're an infant in a carrier, in a cart, some people cover them with a blanket, so there is kind of that barrier there. It is, I guess, less risky in some points. And then, infants, if they, again, are in a infant carrier and they're in the basket of the cart, they're not touching things, they're not coming in contact with people. Generally, you're not around people for that close contact period. So, in that 6-foot distance for long periods of time in the grocery store. So I can't say for certain, but I would say, it's probably not the highest potential for transmission at that point.
Okay, just want to
Right.
remind people.
I would agree, and just toss in there is that remember that there's risk levels no matter what you do, and so you have to assess that risk level. And I agree with what Rebecca's saying is that there are situations that are more risky than others. Yeah.
Okay. We have a couple more minutes left here, so I'm going to roll through as many questions as we can. And if your question does not get answered, you can always email covid19@stclaircounty.org. Okay, so next question is from Michelle. Is the booster shot the same vaccine as the original shots, or is it an updated version to match the Delta variant?
It is the same.
All
Simple
right.
answer.
Yeah.
Yep, it's the same. It's the
Easy.
same. So whether you're getting dose 1, 2, or your booster, it is the exact same formulation. It is not a new formulation at this point.
Okay. Next question is from Melody. I had the J&J one-time shot and ended up in the ER twice. Had to receive breathing treatments, IV steroids, and Benadryl, as well as an epinephrine shot. I now have my own EpiPen. Should I receive a booster of one of the other vaccines?
Wow. Well, Melody, I'm sorry that you had to go through all of that. It sounds like quite the rough road. I guess that would be one that I would encourage you to talk to your primary care physician and determine, what vaccine component perhaps made you have such a strong response to vaccine. And obviously it sounds like it was anaphylaxis or anaphylactic type or allergic type if you have an EpiPen now. So I would encourage you to speak with your physician and try to determine if it was a vaccine component and which component it was. At this point, Johnson & Johnson vaccine does not have a booster. And again, like we talked about previously, they're not recommending mixing brands or manufacturers. And so at this point, I guess you have no booster option. But if the Johnson & Johnson vaccine were to come out with booster, it sounds like you would not be a candidate for that vaccine at this point. But talk to your doctor.
Okay, next question is from Kristen. If my child wears a mask to school, would that exempt them from needing to quarantine?
Not at this time.
Yeah.
Yeah. And
Vaccine.
just so,
So vaccine is what's going to exempt you from quarantine or a recent documented case of COVID. There are some differences in spacing, correct, Rebecca?
For quarantining,
Yeah.
yes.
Yeah, maybe some spacing. That would be it.
all right, just to remind people, we have some school guidance up on our website too, scchealth.co, that lists all of that information as well. Mike has another question. How many people have died after getting the shot? Will we ever know?
I think
Yeah,
Liz
I
is
guess we
talking to
need
Brandon. Yeah.
yeah, I think we need clarification. From this, do you mean died from the shot? Like I got a COVID shot and I ended up dying because I received my COVID shot? Or do you mean I developed COVID after receiving a COVID vaccine series? I'm not sure.
Okay. Next question from
Brandon's
Violet. Will,
Brandon's got
oh,
an answer, or someone will
okay.
answer here. Yeah. So within our county, 0 reported deaths caused by the vaccine, if that helps, Mike.
Okay. All right. Next question is from Melody. Do you think the reaction to the booster will be the same as the second shot?
So there have been some people that have received their additional dose or third dose, those immune compromised persons, and some that I know personally have stated they've had some mild symptoms post vaccine. So, some arm tenderness, some chills, that sort of thing, which they did report after their first and second dose of vaccine as well.
Okay. And this will be the last question. We're at 4 o'clock. From Violet, will the data from breakthrough cases be separated from unvaccinated cases, or will it be lumped into one category? I don't know if Brandon can weigh in here.
Yeah, he's nodding yes.
Okay.
Yep.
All right. That's it. We'll be back next week
Okay.
at 3:30 on Thursday.
Okay. Thank you.
Thank you.